This Let's Talk About Women's Health series has been brought to you by Tallaght University Hospital. These podcasts have been kindly supported by the Healthy Communities Development section of South Dublin County Partnership. Welcome to our fourth episode of this series. I'm Nolene Leddy, and on this podcast we're discussing how women can best protect the health of their heart and bones. To learn more, I'm joined by Shirley Ingram, an Advanced Nurse Practitioner in chest pain, and her colleague David Askin, an Advanced Nurse Practitioner in bone health. You're both very welcome. Shirley, can I start with you? What is the leading cause of death in women and how can we prevent it?
Good morning. I think that is a brilliant question, and actually I think that the answer might surprise our audience and yourself. But women are 6 times more likely to die from heart disease and stroke than breast cancer. And 1 in 4 women will die of heart disease and breast cancer. So that's 1 in 4 women that you know, your mother, your sister, your daughter, your aunt, your friend. A lot of women would not be aware of this. But the good news is, because I don't want to start off with doom and gloom, the good news is that 80% of premature heart disease and diseases that cause stroke are preventable.
That is good news. So how can we prevent heart disease?
The modifiable risk factors for heart disease are similar to those of other diseases such as cancer, and they cross a wide variety of medical conditions such as brain health as well. So things that we can change in our life are stopping smoking. It's the single biggest thing that you can do for your heart and your brain health.
Why is smoking so bad?
Smoking is bad because, it's addictive. It can be a lifelong habit because it is addictive. It contains nicotine, which is the addictive substance. There are also thousands of toxic chemicals in a cigarette. A lot of people don't know that even in a cigarette there's acetone, which is nail polish remover, DDT, rat poison. So there's a lot of other toxic substances. Obviously, we would advise not starting smoking because once you start, it's hard to quit. But there are a lot of supports on hsc.ie, Irish Heart Foundation, to help people stop smoking.
And what about vaping?
I'm glad you asked that because I see a lot of people now and I say, are you a smoker? And they say no. And I say, do you vape or take e-cigarettes? Yes. So there's a perception that if I stop smoking, vaping will help me stop smoking, and that's true. Vaping can help people give up the traditional cigarette. But what is not known is that vaping still contains nicotine, so you're still addicted. Nicotine is also a harmful substance that causes an increase in heart rate, puts stress on the blood vessel walls, increases blood cell stickiness, which can cause clots. So it still has all the chemicals and toxins in it that a traditional cigarette has, and it is addictive. What I'm seeing is people are vaping then for years and years. They've never really broken the habit of smoking. And that is why it's really important that we advocate for people who are struggling to give up cigarettes or vaping to use the services of a smoking cessation professional person. We really do not advocate vaping. And I think the emerging evidence is that it is just as harmful as smoking cigarettes.
How does it impact the heart, in particular smoking?
Smoking causes stickiness in the blood cells. So when we talk about heart disease, I'm talking about a condition called atherosclerosis. It's a big word, but people will know it more as a fatty plaque buildup inside the arteries that supply the heart muscle. So our heart is a pump, but it needs its own blood supply as well. So what smoking does is causes stiffening of our arteries, and it also causes inflammation in our coronary arteries. And this then allows blood fats to build up in the artery as well. And that brings me on to the next modifiable change we can make, which is looking at our diet.
And how is diet important?
In Ireland, we have quite a densely saturated fat diet. If you think of when you go on your holidays, you go to Spain, the Mediterranean diet, lots of fruit and vegetables, alcohol in moderation, lots of oily fish, high fibre, not so much of the white stuff, not so much white bread, white pasta. In Ireland, our diet will be high in saturated hard fats, sweeteners, sugars. We love our takeaways, salty foods.
What do they do to your heart, those kind of foods?
Well, salt will rise your blood pressure. And high blood pressure can cause the blood vessels, these arteries I was talking about, to become stiff. High fats then seep into your bloodstream and build up your cholesterol levels. So everybody's heard about cholesterol.
Yes.
But there's actually 4 fats in our blood that we need to monitor. And the most significant one is called LDL, low density lipoprotein. And this is quite a toxic fat. And this can line the arteries of the heart and cause a narrowing. If you get a narrowing in the artery of your heart, it can cause angina or it can lead to a heart attack. And the same if you get a narrowing in the arteries that provide the blood supply to your brain, it causes a stroke.
And so just explain angina.
Angina occurs when the arteries that supply the muscle, the heart muscle, become narrowed. So therefore, when you want to do something that requires your heart to need a bit more oxygen, like walking briskly up the hill or going for a small cycle, the blood supply is finding it difficult to reach the heart muscle. I always say it's like being in a traffic jam on the M50. The cars can't get through. The blood supply can't get through to the heart muscle. So people experience a discomfort in their chest, which would happen on exertion, but be eased by rest. And that can be the first sign that you might be developing angina, which is caused by a narrowing of the arteries.
And just to clarify, you spoke there about LDL. Is that cholesterol or is it different?
It's a type of cholesterol. As I said, there are 4 fats in the blood. We could do a whole podcast on that alone. My message to people out there really is when you go and have your cholesterol level taken with your GP, ask your GP what the other blood fats were. What was your cholesterol? It should be less than 5. What was your LDL? It should be less than 3. And there are other fats that your GP can talk to you about. And different aspects of your diet can influence these.
And then in terms of exercise and having moderate alcohol intake, are they important for your heart health?
Exercise, absolutely. If I say to my patients, if I could write you a prescription for exercise, I would. And it would say we advise 30 minutes of moderate intensity exercise every single day. So people say, well, what's moderate intensity? So if I'm going for a walk with my friend, I'd like to be able to walk briskly enough that I feel like I'm a bit warm, I'm getting a bit sweaty, I can feel my heart rate going up, I'm a little bit puffed, and we might be finding it difficult, or we might be finding it okay to talk, but I couldn't sing a song or I couldn't whistle. So that's how you know if you're just pushing yourself to the correct exercise intensity.
So David, can I just turn to you now and can we talk about what is osteoporosis in women? What symptoms might a woman have and when should they see their doctor?
Osteoporosis is a thinning process in our bones, as the name suggests, and the bones essentially get thinner as we get older. So from the day we're born, our bones get thicker and thicker. Okay, and from about the age of 50, this starts to decline. And for women in particular, they're at a higher risk of osteoporosis because of the change in hormones. So they lose estrogen, which is generally very protective for bone health and stimulates the cells in the bone. So the bone itself then declines progressively as they get older. So for women over the age of 65 would have a higher risk of osteoporosis.
So in earlier life,
Yes.
starting in our teens, what should women be doing to look after their bone health?
So activity is crucial, as Shirley was saying. So weight-bearing activity is really beneficial for bone and muscle, and particularly as we get older. So the walking exercises are great for the bones in our lower body below our hips. And then class-based exercises, particularly as we get older, are really, really beneficial. In younger years then, field sports are very, very beneficial for maintaining muscle mass and bone health as well. And along with exercise then, nutrition is vital for bone. So sources of protein each day, they can be through animal or vegetable sources. Calcium too then, that's a mineral in bone that creates density and that can provide strength. And once we encourage the dietary calcium each day, that helps to maintain our bone density. So ideally, women should try and achieve about 3 portions of calcium a day. And when we talk about portion sizes, we're talking about 200 mils of milk as a portion, a matchbox size of cheese as a portion, or 125 gram yogurt is a portion.
We hear sometimes that teenage girls are obsessed with being dairy free. Is that a good idea?
No, it's not good to restrict any foods in our diet. So ideally, we want to try and have the broadest diet that we can. Ideally with dairy if you can. And then the vegetables as well are important. Green leafy veg can be a source of calcium too. Nuts as well is very helpful. And then going on to vitamin D too. So in our diet, oily fish is very helpful for both bone and heart. So the vitamin D helps us absorb calcium. And calcium, as I was saying, helps to mineralise the bone. Now we need to be mindful of vitamin D because in Ireland, where we are, we don't always produce enough of it. When the sun shines on our skin, we naturally produce vitamin D. However, we don't always get the summers that we want in Ireland, unfortunately.
For sure.
So it's really beneficial to try and use a fortified produce. So some of the milks, a lot of the milks now come fortified with vitamin D, some cereals, some breads as well. And that's all very, very helpful.
And you mentioned there that older women, their bones might not be as strong. Is menopause the key factor in all of that?
So there's probably over 200 reasons as to why our bones thin out. Okay, but a real driver for women as they get older is the menopause and that loss of hormone. There's other health conditions and sometimes medicines that can impact on bone as well. But for women, the main cause is the change in hormones. And it's not something that we're aware of. So osteoporosis is crowned a silent disease because we don't feel our bones getting thinner. Sometimes signs can be a drop in your height. So if you've noticed that you've lost about 1.5 inches or 4 centimetres, that might be a sign. If you get sudden severe back pain, that might be a sign of a fracture, and that would be a reason to seek medical assessment.
And this is why we do the DEXA scans later for women.
Yeah, so certainly for women over the ages, for 65 and over, a bone density x-ray or DEXA would be indicated. And that's a plain film x-ray of your hips and spine, just to see how dense the structure is. And when you have that x-ray done, either you're in a normal range, you're in a pre-osteoporosis or osteopenia range, or osteoporosis itself. And a diagnosis of osteoporosis means that the bone is fragile and it may fracture from minor stress, such as a fall from standing height or less.
And so if you were perhaps younger and the bone was stronger, you could sustain that fall without a fracture. Is that what you mean?
Possibly, yes. Sometimes it can be related to just too much stress on the bone itself regardless. But in general, the bone is stronger in younger women and it changes over time then.
But it is really important that we make sure we're getting calcium and vitamin D and exercising to try and do as much as we can to offset the onset of osteoporosis.
Absolutely, yeah. And as Shirley was saying as well, we need to minimise our alcohol and be very mindful of that, because we know that alcohol, when we're consuming more than 3 standard units a day, or we're above the 11 standard units in a week, that can have an adverse effect on our bones, particularly with the cells in the bones themselves. And then I suppose with falls too, alcohol can sometimes contribute to falls, particularly when we're on certain medications, and we should be mindful of that too. And again, for bone health, cigarettes is a massive no-no. We see that it affects vitamin D levels. People who smoke tend to run a lower vitamin D level, which then minimises their calcium absorption. And then the chemicals, again, in the cigarettes, they affect the cells directly in the bone.
And if you're obese, does that put your bones at greater risk? Is your frame meant to carry that extra weight?
Well, from an osteoporosis point of view, it's more people who are more petite, who are a smaller build frame, can be at a higher risk for osteoporosis.
And why is that?
That's generally due to there's less bone mass when we're more petite.
So we really have to make sure, I'm 5 foot, that we take our calcium and vitamin D. Shirley, just going back to you, how would you recognise the signs of a heart attack in a woman? And is it any different to a man?
There is a myth that heart disease is a man's disease. And I think people aren't shocked when they hear that a man that has had a heart attack. People are more surprised when they hear it as being about a woman. The other myth too is that women have different symptoms of a heart attack than men. And the evidence is showing that that is just not the case. The majority of people when they're having a heart attack will present with some form of chest discomfort, pain, pressure, heaviness, tightness, squeezing, something along those lines. And they also feel a generalized sense of something is severely wrong here, a sense of doom, if you like. Men tend to seek treatment much quicker. And the evidence shows that women tend to delay presentation to emergency help. They put it down to, oh, I ate something bad last night, or I've pulled a muscle. They tend to kind of try and get the house sorted before they leave. There's a load of barriers that women put in their way before they seek medical attention. Women may also present with other symptoms. So the chest pain, tightness, etc. might not be the most concerning to the woman. A woman might have shoulder discomfort, nausea, a feeling of fullness in the stomach, feeling of breathlessness. For me, the breathlessness, the way I would describe it is that you find it difficult to actually talk, to say a full sentence. Not necessarily that you're puffing and panting, but that you just have a difficulty with your voice getting the words out. So a woman might present and say, I feel a bit breathless, whereas a man might present and say, oh, I have really crushing chest pain. Mm-hmm. And this is where sometimes the delay in a woman actually, so a woman has delayed seeking help herself, then she's delayed getting assessed when she does seek help, because the myths are that you should be kind of having the Hollywood crushing chest pain rolling around in agony. And that's not the case.
Interesting. So if you find yourself with those symptoms, you should immediately go to a doctor or an emergency department.
Yes, I think women, we're very good at listening to our bodies, especially the older we get. And I'd like to come back to menopause in a minute, but I would say to women, please listen to your bodies. Your body will tell you what's going on. If this is new, if this is not normal for you, if you know that there's something not right here, don't delay. Go and seek medical attention and advocate for yourself. It can be difficult to do that at times. Bring somebody with you if possible. If you're feeling sick, if you're feeling sweaty, if you feel like you're getting palpitations as well, say all those things to the medical professional that you meet. Not all women present with the typical risk factor profile, and so heart disease can sometimes be missed.
You mentioned menopause there. How does menopause impact a woman's heart?
So it's really interesting to hear David talk about menopause, and I think menopause affects so many things, and it's wonderful nowadays that we can openly talk about menopause. It's fantastic. Again, nobody's surprised when a younger man has a heart attack, and as David says, osteoporosis is kind of invisible. Heart disease is invisible in women because usually it happens to the older woman, who is less visible than the younger woman. Having said that, heart disease and heart attacks are on the rise in the 40-year-old female as well, and that's largely due to the lifestyle we discussed earlier. So it's important to manage your lifestyle risks at a young age, because menopause is important. As David said, our circulating estrogen level naturally starts to drop. Estrogen protects us, it protects against heart disease and protects our brain health and our bone health. So naturally, as we age, our estrogen, it's designed to drop. So menopause itself does not cause heart disease, let me be clear on that. But what happens is all the risk factors that had built up over the years, smoking, gaining a bit of weight, not being as active as possible, there's no protection then. The estrogen protects us, and that's why heart attacks, angina tend to occur in postmenopausal women, because the risks have already taken hold and created the perfect storm really for heart disease to happen then.
So David, just tell us a little bit more about weight-bearing exercise and why they're so important for maintaining bone health in women.
Yeah, because unfortunately the consequences of osteoporosis are fractures, okay, and they do become more common as we get older. A woman over the age of 50, about 1 in 3 will fracture because of osteoporosis, and that's even higher after the age of 80. 1 in 2 will probably fracture because their bones are getting thinner. So it's really, really important then to continue with exercise. As Shirley was saying, the regular walking 5 days a week, okay, is crucial for our overall health. But then to prevent falls as we get older, it's really, really helpful to do some resistance and balance exercises. And they should be done twice a week.
And what are resistance and balance exercises?
So it's anything that you're putting weight through a limb. So if you're pulling or pushing, lifting. And we now have exercise classes available in the community through the XWell program, okay, which we'll have the link in the podcast. And that can be accessed through your GP or any clinician in the community or hospital can refer you to that. And they give really simple, helpful exercises for balancing, such as standing on one leg. And these are all the really simple things that can change as we get older, that can sometimes contribute to the fall. And generally, if you prevent the fall, you prevent the fracture, because about 80% of fractures happen because of falls from standing height or trips. Very, very simply during everyday activities. So as we say, the balance exercises and then a little bit of resistance as well. And they can all be found out in classes in the community.
And there are even some good videos, free videos on YouTube where you can use your own body weight as the strength and resistance. So you don't need to buy extra equipment.
No, this can even all be done at home. You just need to keep yourself motivated to do it twice a week. That's the key.
And something like a basic squat.
Absolutely.
It's helpful in terms of keeping those bones healthy, but it's the repetition on a daily basis, so it becomes a daily discipline.
Yeah, and it's not that you have to be, you can even do squats from out of a chair, just standing up and sitting back down. And even the Irish Osteoporosis Society have helpful videos too on exercises, which will also be in the links.
Finally, Shirley, any last words of advice?
Well, I would like to think at the end of this podcast, I'd like to encourage women to be part of the Heart Healthy movement, access the resources that we have attached here, especially through the Irish Heart Foundation. They have a very strong campaign called Her Heart Matters, with lots of resources and information for the postmenopausal woman and for the younger woman as well. I'd say as women, we are very good at listening to our bodies, so please do that. I'd like to give permission to women to look after their heart health and their brain health. It's okay. You're allowed to look after yourself and put your heart health first. And my final word is really know what the symptoms are of heart attack. And if you feel them, go and seek help. Attend the emergency department if you're acutely unwell. If symptoms are bothering you for a few months, go and have a chat with your GP. Know your numbers, know your cholesterol level. Find an activity that you love and enjoy. And above all, talk to your female friends. Talk to your mother, your daughter, your sister, your aunt. Have a conversation and tell them that 1 in 4 women will die of heart disease. And I guarantee you that'll get the conversation going.
Thanks, Shirley. David, anything to add?
Yeah, I think what Shirley's saying about talking to each other is so important. And I suppose the psychological impact that life can have on us and stress as well is really, really important. And we've spoke a lot about physical things today, like osteoporosis and heart disease. But in the background, we need to really, really look after ourselves, take time for ourselves, and be mindful as well in our own lives. And be sure that we're not carrying too much stress around with us, because we know the body will secrete natural stress hormones to help us manage things. But over time, these can have a negative impact on our overall health. And I suppose just for people to be aware of their modifiable risks for their health, so their alcohol, their cigarettes, and also to be mindful then of their overall calcium intake from a bone health point of view and the weight-bearing activity.
Well, that's it for this, our 4th episode of the series. Thanks to our expert Shirley Ingram, an advanced nurse practitioner in chest pain, and her colleague David Askin, an advanced nurse practitioner in bone health. Our next podcast will look at how women can keep their brains healthy and how to cope with brain fog. This Let's Talk About Women's Health series has been brought to you by Tallaght University Hospital. These podcasts have been kindly supported by the Healthy Community section of South Dublin County Partnership.